Fine. So once again, I welcome you all. As we know, today we have gathered here on the occasion of World Mental Health Day. To celebrate this, we are hosting the national level webinar to talk about this. And here we have eminent speakers across the country, and we are going to learn a lot from them. And before that, let me just give a brief introduction of all the speakers that's going to speak today. As is scheduled today, our first speaker, Mrs. Priyadarshini, working as a lecturer in Vinayaka Mission College of Nursing. She qualified in nursing, both BSc and MSc. She did a BSc nursing in East Coast College of Nursing, Puducherry, and MSc in Mother Teresa Postgraduate Institute in Puducherry. And she's pursuing her PG diploma in guidance and counseling in Annamalai University, and also PG diploma in community mental health from NIMHANS. She has worked as a tutor and also currently working as a lecturer in Vinayaka Mission Medical College at Nursing College in Puducherry. And she received many awards and attended many trainings conference. And she done many 17 publications in her account, and also she completed 4 research projects, funded projects, and many research projects are undergoing. And now we are happy to have her today to present the topic of today's event. First topic about human rights and perspective of mental health.
Good evening, one and all.
Yeah.
I'm
Just a
audible.
second, madam. Yeah. Just a second, madam, please. Let me introduce all the speakers. Can you hear me, everybody? Hope you can hear me, I think. Yeah. So before getting into the first presentation, let us explore, the theme of today's presentation. We have madam from the Chitkara University, Ms.Bijialuxmi Devi, madam, and she'll be unfolding the theme of today's event. And I invite madam, please unfold the theme of today's event, then we'll proceed with the first session. Ma'am.
Good evening, sir.
Yes, ma'am. Yes, please.
Sir, am I audible?
Yes, madam, you are audible.
Sir, am I audible? I'm visible to sir.
Yes, madam. Yes, madam, please.
Today, actually, first of all, we are organizing World Mental Health Day. And this year, we have to focus on our theme, that is mental health is a universal human right. First of all, I would like to extend gratitude to Innovative Alliance for Public Health, also Nursing Scholar Society, and Mind and Sex Clinic, Nagpur, as well as World Explorer India YouTube channel for involving us in organizing such vast platform so that we can build awareness among the community people and various faculties members, various students who are joining over this. So this year we have theme that is on mental health is a universal human right. So actually the theme is Sir, am I visible now?
Yes, madam. Yes,
no slides.
Yeah.
Slides छोटा तो नहीं होने से वैसे ही same ही sir.
Yeah, it is visible. You can proceed, please.
Okay, sir. So regarding this mental health is a universal right. The main focus we are going to today, we're going to focus today is on minds and our rights. which is an opportunities for people and communities to unite behind the theme. Mental health is a universal human rights. So what we know is it is usually to improve knowledge, raise awareness among the people, drive actions that promote and protect everyone's mental health as a universal human rights. Because when we talk about health, we usually focus upon our physical health, spiritual health, emotional health. The mental health is usually ignored. So this year we are going to focus that each and every individual with mental health have their own rights. That is the rights to choose whether they want to get admitted in particular settings, they want to have rehabilitations, which type of therapies they want to use for the well-being of their own mental health. So this is the main point, because moreover when we talk about patient or a person with a mental illness, we thought that they are not able to take any judgment, they are not able to talk about something, so we usually ignore it. So this year we are going to focus that being a human being, those mentally ill persons, those mentally disordered people have their own human right to express their emotions, to express their choice, to express their feelings, and to choose what and which type of treatment they are going to take over. So mental health is a basic human rights for all people. So everyone and whoever and whatever they are has a right to the highest attainable standards of mental health. So this includes the right to be protected from mental health risks, that is the right to be protected for harmful incident, the right to available, accessible and acceptable good quality of mental health from any settings, that is to a hospital or either from a half day center, for rehabilitation center, even though in de-addiction center, and the independence and inclusion in the community. But because most of the time we exclude them from any in the community participation, and one of the this is one of the most important factors we are going to discuss in today's topic. So here I would like to focus on incidents regarding mental health among the Indian. So what happened that most among the male and the female, mental illness are mostly prevalent among male. There is 13.9% of male in India having mental illness, and only 7.5% of female, even though it is minimal in numbers, it is high in incidence. So in mental disorders, most of the settings we thought that in ICU settings we have that for each and every patient we have to have, for each and every nurses we have to have 5 patients, 1:5, 1:20, 1:10. But regarding mental health, we have lack of workforce in India. That is, according to WHO, they recommended that per 10,000 psychiatric illness patients, we have to have 3 psychiatrists. But now, as per our researches, there is only 0.3 psychiatrists who are treating with our mental disorder patients. Nurses are only 0.112, psychologists are 0.07, and social workers are also in the count of 0.07. So we have to improve all these dimensions, that whether we have to focus on the uh, uh, organizing settings, institutional settings. So we have to focus mainly on the patients which having mental disorders. So while ending with this unfolding of the theme, I would like to request all the participants to promote, to spread awareness about and drive the actions that promote and protect everyone's mental health as a universal human right. That is universal. Good mental health is vital to our overall health. So we have to promote mental health to each and every individual. So let's break the stigma and embrace the importance of mental health. Thank you, sir.
Thank you, ma'am, for your introduction. And now I invite Priyadarshini, ma'am, to talk about the first topic of today's event, that is human rights perspective of mental health. Ma'am, time is yours. Please take over.
Thank you so much for the nice introduction, sir. Am I audible?
Yeah, madam, you are audible, please.
Is my slides visible, sir? Can I proceed?
Yeah, slides visible, please proceed.
Okay, so today I'm going to present about the human rights perspectives of mental health. so many associations, so many organizations who are contributing to the mental health have told many rights for the mentally ill patients or person affected with mental illness. Today, I'm going to highlight the rights of mentally ill patients in par with the Mental Health Care Act 2017. So let us see what are all the rights. The first right is right to access mental health care. So as per the Mental Health Care Act 2017, so they say that every person shall have a right to access mental health care and treatment from mental health services which are run or funded by the appropriate government. And according to the section 18.1 and 18.2, the mental health services should be delivered at affordable cost, good quality, available in sufficient quantity, and it should be accessible within the geographical limits, and it should be given without any discrimination, and it should be in an acceptable manner. So as per the according to the person's capability and also the family considering the caregiver situation. And section 18.7, so they say that the mentally ill person or the person with mental illness should have the provisions for outpatient and inpatient services, halfway homes, sheltered accommodation, hospital and community-based rehabilitation, child and old age mental health services like that, etc. So many things they have given. In case if the district hospital couldn't give this for the person with mental illness, they should afford or they should provide remuneration for the patient to access these mental health services in nearby districts. So that was told in this Mental Health Care Act 2017. So this was about the first right, that is the right to access mental health care. So every person has the right to access the mental health care. And coming for the next one, so they are having the right to community living. Like this is based on the section 19.1. So every person with mental illness, they have a right to live in, be a part of, and not be segregated from society, and not continue to remain in a mental health establishment merely because he does not have a family or is not accepted by his family or is homeless or due to absence of community-based facilities. Here, I would like to talk two examples. So, which are the cases which happened in India. So, in a landmark verdict in 2018, the Delhi High Court asked the parents to compensate for the doctor for their daughter. So, since they violated their right to choose where she can stay, and they forced her to stay in a mental hospital, and they picked her from the residence of a music teacher, and they detained her in a mental institution where she was forced to spend 1 day and 1 night. So in this case, the Delhi High Court told the parents to compensate for her daughter. So they appeared to the Supreme Court and they also told the same as like the Delhi High Court. So this is one example. And one more example I want to tell. So on 25th November 2017, so there was a petition under Article 2026. So in this case, son, he just put a habeas corpus for the release of his father, who is 71 years old. So his name is Ram Kumar. So actually, so he was detained in a mental health establishment. So that is exactly Institute of Human Behavior and Allied Sciences at Delhi. So he filed habeas corpus. And what was the judgment? So it was interesting. So the court expresses its apology. So it directs a token compensation of rupees 2 lakh shall be paid. It was paid by the government. So these were two examples. So when a person are prohibited from living in a community, or when they are segregated from the society, they are having the right. So this right states that they are also having the right to stay in community. So this is one right. And next, right to protection from cruel, inhuman, and degrading treatment. So this is according to section 19.1. So they are having the right to live in safe and hygienic environment. They are having the right to have adequate sanitary condition, to have reasonable facilities for leisure, recreation, education, and religious practices, and also for privacy. And no one should be compelled to wear uniform. So they are having the right to wear the clothes with their wish. So for proper clothing, so as to protect such person from exposure of his body to maintain his dignity, and they should not be forced to undertake work in a mental health establishment. And if they are working for that, they should receive appropriate remuneration, and they should have adequate provision for preparing for the living in the community. In case if she is a woman, so they should, in particular, the women should have the access to the items that may be required during menstruation. So this was added in the Mental Health Care Act 2017. And previously, you see people with mental illness, they were compelled to do tonsure, that is a shaving of their head hair. So now, according to this act, so they are prohibiting this, and they strictly say no to this. So any subject, they should not be forced, or they should not undergo, or they should not forced to do tonsure like that. And they are, as I said, they are not forced to wear uniforms. They can wear whatever clothes they want, and they should be protected from all forms of physical, verbal, emotional, as well as sexual abuse. So next right is right to equality and non-discrimination. So they should be given care irrespective of their gender, race, color, creed, etc., etc. And this is according to section 18.8. And particularly when a woman is having a child under the age of 3. Okay, so a child under the age of 3 years of a woman receiving care, treatment, or rehabilitation at a mental health establishment shall ordinarily not be separated from her during her stay in such establishment. So, when a mother is getting treatment in a mental health establishment, if she is having a child less than 3 years, the mother has the right to take care of the baby in the mental health establishment. If there is a threat to the baby's life or something, if there is any abnormality, then the psychiatrist who is present there, they have to assist the women every 15 days once, and based on the situation, they have to take the decision. So next is about medical insurance. So previously, physical illnesses were given medical insurance, and no insurance company, they came forward to provide medical insurance for the persons with mental illness. But this Mental Health Care Act 2017, it emphasizes every insurance company, it should provide medical insurance for persons with mental illness, as like they do for the physical illness. And every insurer shall make provision for medical insurance for treatment of mental illness on the same basis. So now all persons with mental illness have the right to get medical insurance, and they can claim their medical insurance. And this is one right. And next, I'm moving to another thing. So that is the right to make an advance directive. I hope you all know very well about advance directive. So when a person the person who's affected with mental illness, they can make a will, something like a will, that whenever they cannot take a decision of their own health condition, they can take it in a they can take it priorly. Okay, so a person shall have the right to make an advance directive stating how to be treated and how not to be treated for the illness during a mental health situation. They even have the right to say whether they can receive ECT or they cannot receive ECT. So this is based on the sections from 5 to 13. So they have the right to make an advance directive. And next, the right to appoint a nominated representative. A nominated representative may be a relative. So all those who can be a nominated representative. And since my time is very short, I couldn't go in detail. So sections 14 to 17, they deal with the nominated representative. So a person with mental illness can appoint a nominated representative. The clear roles, responsibilities of a nominated representative, it is given in Mental Health Care Act 2017. So they may take a health-related decision on the behalf of person with mental illness. So this is one right. And next is right to information. So you cannot think they are just a psychiatric patient, a person with mental illness. If I explain, are they going to understand like that? We can never think like that. So they have the right to get proper information about their criteria for admission. In case if they want to apply to the concerned board for review of their admission, they can apply for that, and the mental health professional are liable and they have to help them to apply for the consent board, and they have the right to know about the nature of the present mental illness, what they are undergoing, and what is the proposed treatment plan. Through the proposed treatment, whether they get any side effects, and they have the right to receive all these information in a language which they understand. So that is preferably their local language or their mother tongue. So in a way that a person can understand what is going on in their health status, what about their treatment, what they are undergoing. So they are having the right to know about each and everything. So this is one right. And next is right to confidentiality. So here also we have to ensure that we are maintaining confidentiality. But here there is some special circumstances when a mental health professional can release information. So the release of information can be done only under special circumstances, like when the nominated representative want to know about what is happening for the patient exactly, or to discuss with the other mental health professional to that will help in giving treatment for the patient, to protect any other person from harm or violence. In case if there is a threat because of this patient, at that time we can release the information and to prevent threat to life. And when the concerned body or central authority or high court or supreme court or any other statutory authority who's competent, when they request, we can release the information. And when they affect public safety and security, at all these special circumstances, release of information can be done. But the mental health professional should ensure the confidentiality. And moreover, no photograph or any other information which are related to the patients, which are related to the person with mental illness who is undergoing treatment in any kind of mental health establishment, it should never be released, or it should never be used in any social medias or any other media without the consent of the person with mental illness. So that is very, very important. And it applies to all the information that is stored in electronic or digital format, that is in real or as well as in the virtual space. So you should never reveal the photograph. You should maintain anonymity. So that is one right. And next, we are going to see about the next right, that is the right to access medical records. So the patient have the rights to access their medical records. So we can withhold specific information, and that too under that particular special circumstances that we are going to discuss. So if you think that the serious mental harm to the person with mental illness, so if you disclose this information, it can result in some serious mental harm, then you can withhold the information, or or sometimes it may affect the livelihood of other person. So when it causes harm to other person, at that time you can withhold specific information. And even in that case, when this person with mental illness, they apply to the concerned body seeking their medical records, we have to release such information. So they have the right to access medical records. Next right, it is right to personal contacts and communication. So you cannot deny. So if a patient is asking, I want to talk to my parents, I want to talk to my partner, you can never ever deny. So they have the right to refuse or receive visitors. So they can choose whom they can visit, whom they can avoid. That they can do. And they have the right to refuse or receive and make telephones or mobile phone calls. But it is not every time. Whenever the patient thinks, they cannot do that. So at reasonable times, that is subject to the norms of such mental health establishments. So according to the hospital situation and according to the norms and policies of the hospital, when the patient is having any reasonable things, they can make a telephone call, or they can make a mobile phone call, and they can receive a phone call. And this also suits for the email. So they may decide, they may not, they may choose whether they can send or receive email through the electronic mode, that also they have the rights. So under certain special circumstances, you can make them uh, it includes any judge or officer authorized by a competent court when they are asking, or when a member of the concerned body or the state authority or the central authority is asking, if a member of parliament, that is not under the political pressure or something like that, only if the patient is having they are having willing, or they are contributing to the help, or they are trying to help, that time you can allow the persons to talk with the persons with mental illness. So like the nominated representative, lawyer, legal representative, so any other person who are authorized by the appropriate government, they can call or they can visit the person with mental illness. So these are all certain special circumstances. So next we are going to see the next right, that is the right to legal aid. So free legal services under the Legal Services Authorities Act, that is 1987, Section 39, or other relevant laws, or under any order of the court, if so ordered, and provide the contact details of the availability of services. So they are having access, so they can access free legal services according to Section 39. And if they want to know more about the details, whom they can see, where they can apply, so whatever information, so we have to tell them the contact details. And the next right is right to make complaints about deficiency in provision of services. So if they think they do not get adequate care from the mental health establishment, or their rights or their dignity is not maintained, so if they see any violation in that, they are having the right to make complaint about the deficiency they see. So the provisions for making complaint in subsection 1 is without prejudice the rights of a person to seek any judicial remedy for violation of his right in a mental health establishment, or by any mental health professional, either under this act or any other law for the time being in force. So they are having these rights. So medical professional, be very, very cautious when dealing with a person with mental illness. And next, as per this Mental Health Care Act 2017, we are going to see what are all the prohibited procedure, or what are all the restrictions they have claimed for giving certain procedure. So according to this act, they say no to ECT without anesthesia. So you cannot give a direct ECT without giving anesthesia or muscle relaxant. So ECT shall not be performed without the use of muscle relaxant and anesthesia. This is section 95.1A. So restriction on electroconvulsive therapy, that is for minors. So for minors, actually what they say is preferably we have to go for some other treatment modalities. So when it is absolutely necessary, so we have to get proper informed consent from the guardian, and we have to apply to the concerned body and seek prior permission to give ECT for a minor. So they prohibit giving ECT without anesthesia and muscle relaxant. So ECT should be given only with the anesthesia and muscle relaxant. And next is no sterilization. So this is section 95.1C. So sterilization of women or men intended as a treatment for mental illness shall not be done. So this was a myth actually. So when we do sterilization, sometimes they may think in that way, and sometimes usually person with mental illness, they are more prone to be abused. For that, sometimes the relatives may do something like that. So they have restricted that. And no mechanical restraint. So there shall be no chaining a person with mental illness in any manner or form. So that is section 95.1D. If a person is doing that, they are strictly punishable. They are punishable. And next one, restriction on psychosurgery. So they told that psychosurgery shall not be performed as a treatment for mental illness without obtaining the proper informed consent of the patient and approval from the board. And next, they have given, as I told, restriction on physical restraints, like when it is absolutely needed, they can put physical restraint, but they have given certain rules and regulation when we can put. So you can go that in a detail when you see that Mental Health Care Act. And no solitary confinement. So seclusion cannot be done for any persons with mental illness. Okay. So I'm here to ask a question. Do you think suicide is a punishable offense? Now, participants, you can say yes or no, or else you can chat in chat box. No response? Do you think suicide is a punishable offense? Am I audible? Am I audible?
Yes, ma'am, you are audible.
Oh, thank you. Thank you for your response. So according to the Mental Health Care Act 2017, they have decriminalized the suicidal attempt. So what they say is a person who is attempting suicide, they do because of some psychological distress. So they should be evaluated and they should get appropriate treatment. So instead, we should not punish that patient. So it is the mere responsibility of the state government. So they hold the responsibility to provide care for the person who's attempting suicide. So according to this act, they take care of the persons who's attempting suicide and they have decriminalized the suicide. So my next question. So if a person found after their marriage that their partner is having psychiatric problem or illness, can he or she divorce? What is your opinion? Yes, no? So after marriage, so a person is found to be having some psychiatric illness or psychiatric problem. Can the partner divorce? Yes or no? Any idea? So I didn't get any response. So let me proceed. So no. So divorce can be sought only if an individual is suffering from psychiatric problems or illness to such extent that he or she is not able to fulfill the responsibility of the marriage. And here you see the years for 2 or more than 2 years. Further reasonable attempts to treat the mental illness made, which need to be treatment resistant to grant divorce. So they cannot divorce their partner. So sometimes these things are misused. So my next question, can a person with mental illness has the right to vote? Do they have the right to vote? Not at all getting any response from the audience. Can't you understand what I'm speaking?
Ma'am, they are sharing their response in the chat box.
Okay. Yes, no, yes. Okay. So, under Article 326 of the Constitution of India, no person declared to be of sound mind by a court can vote. So, they don't have, when they are declared, they are having unsound mind by a court, they can never vote. And even according to under Article 102 of the Constitution of India, a person is disqualified by from being chosen as or for a member of either House of Parliament or if he is of unsound mind and stands so declared by a competent court. So even they cannot compete in election and they cannot vote. So this is just the gist about the rights of mental health person with mental illness. So there is a lot of things. So within this short span of time, I'm just giving a gist and just giving a glimpse. If you want to read further, so you can go on, you can download it very well in the Google. So if you put Mental Health Care Act 2017, so you see what nicely they have given all the relevant information. So if you have any doubts, you can ask me. Any doubts? Okay, so I just want to conclude my presentation by saying our theme. So I just want to emphasize the theme again. So mental health is a universal human right. So mental health professional, I know the stalwarts from various parts of India in psychiatric nursing are attending this webinar. So just we have to work more to make this into reality. Thank you for listening. Thank you for patient listening. I thank the organizers for giving me such a wonderful opportunity. Thank you so much.
Activity now, research and publications we are planning. Oh, thank you, ma'am. It was a really detailed and wonderful presentation. Am I audible, right?
Yes, sir, you're audible.
Yeah. Thank you so much. It was really a detailed presentation from you, and I hope all the participants, learned a lot from the presentation. And without further delay, let us proceed further to the next session. I'll invite our next speaker, Ms. Gagan Sharma, ma'am, and she's currently working as an associate professor in Chitkara University. Madam has done her UG in the year 2010 and also done her PG in 2013 medical surgical nursing. And Madam has participated in many webinars, conferences, and also she published many scientific papers in the reputed journals. And I invite Madam to share her thought on the next topic, liaison psychiatric nursing. Madam, time is yours. Please lead us.
Good evening, sir.
Yeah, good evening, ma'am.
Thank you so much, sir, for the
Thank you,
introduction. So my PPT is visible.
Please put it in slide share mode, ma'am. I'm in presentation mode.
Okay.
It is visible.
Okay. Thank you, sir. Thank you.
Yeah.
Good evening, everyone. Today we are diving into a topic that is at the heart of.
Sorry to
Yes.
interrupt. Please click hide when Teams is sharing a screen.
Yeah,
Right?
sure.
Click on hide so that.
Is it fine, sir?
Yeah. Now fine. Please proceed, ma'am. Thank you.
Okay, sir. Okay, sir. So today we are diving into a topic that is at the heart of compassionate and holistic patient care. We are going to explore the essential role of liaison nurse in healthcare. But first, let me share one story. This story is dependent on the Ravika's journey. She is a patient admitted in the surgical ICU named Mrs. Ravika. She is 65 years old woman who recently underwent a complex surgery. After her procedure, she faced not only the physical challenge of recovery, but also the emotional roller coaster of uncertainty and fear. Like many patients, Ravika needed more than just medical attention. She needed someone who could understand and address her emotional and psychological needs. So I'm having one question for you all. Have you or a loved one ever been in a situation where the care you needed went beyond the medical treatment itself, where emotional support, understanding, and guidance were just as critical as the medication and procedure? I think everyone, anyhow, face such issues with the family member, with like in any situation in the life, right? So I think like here, what happened? It's clear that the need for comprehensive patient-centered care is something many of us have experienced. This is where liaison nurse come into play. They are the unsung heroes of healthcare, bringing the gap between medical treatment and emotional support. In Ravika's case, a liaison nurse became her guiding light through the darkest moment of her recovery. So in the next hour, we will dig into the multi-phase role of the liaison nurse in healthcare. We will explore the challenge they face, the impact they make on patient outcome, and why their presence on the healthcare team is more critical now than ever before. So first we'll deal with the statistics related to the importance of addressing mental health. So here you can see that 10.7% of the world suffer from some form of mental illness. Here, the National Alliance on the Mental Illness starts showing the symptom by the age of 14. So the Center for Disease Control and the Prevention accounts 6 million visits to primary care and 6 million emergency visits annually. Mental health first aid, 14% of Americans dealt with an untreated mental illness. In India, approximately 56 million people in the country are thought to suffer from depression, with another 38 million suffering from anxiety disorder. According to WHO, the economic loss due to the mental health condition between 2012 to 2030 is estimated as $1.03 trillion. The burden of mental health problem in India is 2443 disability adjusted life year per 1 lakh person. So in the world of healthcare, we often focus primarily on the physical aspect of illness and injury. However, we sometimes forget that a patient mental and the emotional well-being is equally critical to their overall health and recovery. Imagine a scenario in a bustling emergency room. A patient arrives physically stable but utterly overwhelmed by the anxiety and disappear. Despite their lack of visible injury, they are in as much distress as any other patient. This illustrates a crucial point. Healthcare is not just about mending the body, it's about healing the mind as well. So today I would like to introduce you to a group of healthcare professionals who bridge the crucial gap between the physical illness and the emotional illness. The one are psychiatric consultant and licensed nurses. These are the unsung hero of healthcare professional who specialize in addressing the emotional, spiritual, cognitive, and the behavioral aspect of the patient experience. Sometimes which is neglected while taking care of the patient, and we are achieving the physical component of the health and we are ignoring the emotional health of the patient. So psychiatric consultant and the licensed nurses are registered nurse with advanced training in mental health and the psychiatric care. They work in various healthcare settings, including hospital, clinic, de-addiction center, then long-term care facilities. They are working along with the social group people, the NGOs. The licensed nurses bridge the gap between the physical and mental health care by providing the expertise in assessing, managing mental and the emotional well-being of patient. Just here I got one example. A young woman in her 30s seemed healthy and active, who visit her doctor complaining of persistent fatigue and unexplained physical symptoms. After numerous tests and consultation with specialists, her medical condition remained a mystery. She is frustrated and her health is deteriorating day by day, and the frustration is increases day by day. Finally, a psychiatric consultant steps in and takes a time to ask a simple yet crucial question. How have you been feeling emotionally lately? Then immediately that woman break down in tears and she revealed that she has been struggling with anxiety and overwhelming stress due to work and the personal issues. You just see that just one question which is just triggering the emotion of the person and she's just come out with the thing. This grief lead to a profound transformation in her care with the inclusion, whatever the disclosure she has done with the psychiatric nurse. With that, she got the mental health support. Her overall condition improved dramatically, and she began to regain her health and vitality. You just see that, like when we are addressing mental health issue in healthcare setting, can be the missing piece in providing the comprehensive care to the patient. Yes, It's happened in the emergency areas. It's happened in the when we are taking care of the physical component, but we are ignoring the emotional health. Sometimes we are not skillful in that. We don't have a competency to how to heal the emotional health. Then we are ignoring it, and it lead devastating changes in the health of the patient. So, psychiatric consultant required good knowledge, skills for diagnosis, treatment, monitoring, and prevention of the psychiatric disorder in patient with physical disease experience emotional stress. So illness is covered under the licensed psychiatry. That is, here I had given the broad classification: neurological illness, like Parkinson disease, multiple sclerosis, cerebrovascular diseases, endocrine illness like diabetes mellitus, hypothyroidism. The person is undergone with the stress of taking the daily medications, adhere to the treatment, adhere to the diet, adhere to the exercise. Sometimes it lead to the stress in the person body, and it may lead to the fatigability, it may lead to the deterioration in the physical health. So rheumatic illness, SLE, giant cell arteritis, cardiovascular illness, heart diseases, vascular diseases, psychiatric adverse effect, then the complicated systemic medical and the psychiatric illness. So these are the broad areas where we needed a licensed psychiatric nurses. The most common disorder in the general medical setting, you just see that when we are going in the general medical setting, so we'll go according to age we are getting. These all are the condition like dementia, delirium, then the person who met with the traumatic brain injuries, then abnormal movement, behavior, withdrawal behavior, psychotic medical and other disorders, substance use disorders, then melancholic, depressive conditions, then acute psychotic states, maybe the traumatic stress disorder, post-traumatic stress disorder, amputation. These all the factor is leading or the need for the licensed nurse. So need expert. What is the need for the licensed psychiatric nurse? Expert in managing complex psychiatric illness in general hospital and the emergency department. We needed the licensed nurse. We needed one licensed nurse in a health team member. Work in collaboration with the multidisciplinary team. Yes, early adapter for innovating communication and the other technology, advancing patient care. Like technology include the provision of the telemedicine, telepsychiatric, creative use of the electronic health records, which is going to help the enhancing psychiatric care for medical patients, standardized clinical pathway, incorporation of outcome, and the rating measures. Emerging areas like medical, genomic, psychiatric, which is related to the genetic, monitoring drug interactions, management of the behavioral and the cognitive syndrome with complicated attributable systemic illness causes. Consultant licensed psychiatric is at the forefront of clinical and the administrative leadership for the psychiatric. Role of mental health licensed nurse. Work in conjunction with other agency within and the external to the place of the work, providing a comprehensive and the individualized package of care to the patient, providing emergency psychiatric risk assessment, immediate management plans for all referral to the services, respond in a supportive and problem solving manners to professional and members of the public phoning the service seeking help with the mental health problem, provide post assessment brief intervention support encompassing, able to manage acute distress, aggression, and crisis situation, deal with these effectively and safely. Initiate referral to inpatient care, continuous improvement of the knowledge by evidence-based practices, work in accordance with the guidelines as per the institution protocols, provide advice and support to nursing staff within all clinical area, ensuring that patient needs are assessed, care planned, implemented and evaluated, and ensure the involvement of patient and caregiver. Provide the support in the management of self-harm, mental health problem, and health promotion. These are the roles of the licensed nurse. What kind of the knowledge, training, experience required to do the licensed nurse job? She should be specialized in mental health nursing, should have a continuous learning evidences like counseling courses, cognitive behavioral therapy, psychotic therapy. She should be well versed about these all things. Then the effective listening and the communication skill while dealing with the patient's emotions. She should have a patience and the listening skill and the good communication skills, time management skills, work with on initiatives, good problem solving skills. Like she is the one who is like helping the patient to deal with the coping strategies, how to adapt the coping strategy to prevent the crisis. Then they're able to work with the computer and the video conferences. She should be technological sound. Next is the responsibility of the licensed nurse. First one is the assessment and evaluation. Psychiatric consultant or licensed nurse conduct thorough assessment to evaluate a patient's mental and emotional state. This information about the patient, like medical history, psychological history, and the current emotional well-being is needed to assess. Then mental health support. Second one is the mental health support. These nurses offer emotional support and counseling to patients who may be experiencing distress, anxiety, depression, or other mental health challenges due to their medical conditions. So she should know about, like, she should offer the emotional support and the counseling to the patient. Then crisis intervention. In this situation where patients are in crisis, such as a person having a severe anxiety, suicidal thought, licensed nurse provide the immediate intervention and support to ensure the safety and well-being of the patient. Collaboration. They collaborate closely with other healthcare professionals, including physician, surgeon, case manager, social worker, to develop and implement the holistic care plans that address both physical and the mental health needs. Then advocacy. They serve as advocate for patient. Nurse is an advocate for a patient. For a licensed nurse, ensuring that their patient emotional and the psychological needs are considered as an integral part of their care plan. This advocacy may involve communicating with the healthcare team and helping access appropriate mental health services by the patient. Then crisis preventions. These nurses also work proactively to prevent the emotional crisis by identifying patient at risk and implementing preventive measures and coping strategies. She should support the family in like while caring the adult patient, mother, like babies, neonatal, young, how to deal with the young, like how to make a relationship with the among the family member. You should support the families. End of life care in this situation involving end of life decision, like psychiatric nurse plays a crucial role in providing the support to both patient and their families, helping them navigate the emotional challenges of this difficult time. Then pediatric care. They are having a specialized training to work with pediatric population, where they adapt their approaches to meet the unique level of the emotion and the development need of the children and adolescent facing medical conditions. So these are the yes, and one is the evidence-based practices. She must be aware, like whatever the like new coping strategies in the environment, how to incorporate among the patients. Like she's dealing with the person who is having a physical illness as well as the emotional illness, so she must have a good command, good knowledge and the skills on the physical illness as well as the emotional illness, how they are counter each other. So these are the responsibility as a licensed nurse. Importance of addressing, like here we are talking about the physical health, emotional health. If the emotional health is not good, then it may lead to the deterioration in the physical health. So along with the physical deterioration, why we have to take care of the emotional health. So why there is an importance. The first one is the mental health and well-being. Emotional needs are a fundamental components of mental health and the overall well-being. Addressing emotional need is essential for promoting the mental well-being. Second one is the physical health. Emotional well-being is indirect linked to the physical health, because chronic stress and the emotional distress can contribute to a range of physical health problems, including heart disease, digestive issues, and weakened immune function. Like while these addressing the emotional need, individual can better protect their physical health. Coping and resilience. People face a variety of challenge and the stress throughout their lives. Like they are having they can't what is the scenario? Like they are having adjustment issues. They can't adjust. Whatever the changes came in their life, they are not adjusted with the change. So for a good healthy person, for a emotional well-being, good emotional well-being, we have to cultivate the habits of the adjustability among the patients, right? Then like secure the attachment with the others and the ability to engage their support. Like they have to check their goals. They must have a great sense of humor, patience, high tolerance of the negative effect, optimistic, high level of adaptability. These all the factors lead for the coping and the resilience in the life. Healthy relationship. Meeting emotional need is crucial for maintaining healthy relationship with other. It fosters empathy, understanding, and the effective communication, which are the building block of strong personal and the professional relationship. Enhance the decision making. If we are emotionally balanced, then we can able to make a better decision in each and every situation of the life. Workplace productivity. uh, in the professional setting, employee with their emotional needs met are generally more engaged, motivated, and productive. Employer who prioritize emotional well-being often see reduce the absenteeism and the turnover rate. So always be the optimistic while working. Okay, you have rehearsed ahead of time, be direct and clear, share a list of like accommodations, express your motivation and the commitment to work, but don't see towards the don't share the info your employer doesn't need, like complain about your workplaces, assume how your boss will react. That all the factor can lead to the negativity, and it may reduce the productivity at your work culture. Parenting and the family dynamics. Addressing emotional need within family is essential for creating and nurturing supporting environment among the family member. This in turn help children develop healthy emotional regulation and interpersonal skills. Personal fulfillment. Meeting emotional need is central to personal fulfillment and life satisfaction. When individuals feel emotionally fulfilled, they are more likely to pursue their passion, set and achieve goal, and lead a fulfilled life. Community and society. Emotionally well adjusted individuals are more likely to participate in community activities, support one another, and contribute positively to the social cohesion. Prevention of mental health issues. Proactively addressing emotional need can serve as a preventive measure against the development of more serious mental health disorder. Early intervention and support can mitigate the progression of the emotional distress into the severe conditions. Reduce stigma. Encouraging the open discussion of emotional need reduce the stigma associated with the mental illness. So these are the factor which help to build up the emotional need, why the emotional health is needed to be a good person in the society, to maintain a good relationship, to a professional, to get a good professional life, personal achievement, we need a good emotional health. So here I am having one case study, like how the physical condition and the emotional condition is coming together, and it is going to deteriorate the health of the person, and how we, being a licensed nurse, how we can maintain the balance between the physical and the emotional health. So here one first scenario is Mr. A, a 55 years old man, was admitted to the hospital with severe chronic pain resulting from a serious accident. He had been experiencing intense depression due to the constant pain and the loss of the independence. So you just see that because of the chronic pain, it leads the depression in the person. So here the psychiatric nurse or licensed nurse conducted thorough assessment, recognized the profound impact of the chronic pain of Mr. A. Emotional well-being, a multidisciplinary care plan was developed involving pain management specialist, physical therapist, and the psychiatric nurse. What was the outcome when we are working together, like the person who is taking care of the physical issues and the one person who is taking care of the emotional health? Then what could be the outcome? With a combined approach addressing both his physical pain and the emotional distress, Mr. A experienced significant improvement. His pain was managed more effectively and his depression began to lift. He engaged in therapy session to learn coping strategy for managing pain-related anxiety and depression. You just see that because of the chronic pain, patient going into the depression, he just lose his independency, right? And every day he was like going into the phase of the anxiety and the depression. But when you are correcting his emotional illness along with the physical illness, then what happened? The things are getting changed. The person is going to change his lifestyle. Then second scenario, pediatric support in ICU. There is one baby girl, 9 years old, Emily, was admitted to the pediatric intensive care unit after a severe asthma attack that required mechanical ventilation. Her parents were extremely anxious and distraught. Right? So the licensed nurse recognized the emotional turmoil experienced by Emily parents. They provide emotional support, educate the parents about the ICU environment, whatever the procedure is happen on the patient, they are like educating them, right? Because of that, what happened? Their anxiety relieved. They get the confidence on the team. So outcome was Emily parents reported feeling more informed and supported, reducing their anxiety. Emily herself responded positively to her parents, improved emotionally state, then contributing to a more cooperative and the healing atmosphere in the PICU. You just see that how the scenarios getting changed. Then third scenario is end of life care. How the licensed nurse worked here. The patient, Mrs. L, an 80 years old woman with advanced cancer, was in the final stage of her illness and receiving the palliative care in a hospice setting. Her family was struggling to cope with the impending loss. The intervention was a psychiatric nurse, worked closely with Mrs. L family, offering grief counseling, emotional support, assisting in understanding the dying process, what are the stages, right? They facilitate family meetings to address concern and providing the resource for grief support. Outcome was Mrs. L passed away peacefully, surrounded by her loving family, who felt more prepared for her death due to the emotional support and guidance provided. The family continued to access the bereavement services after her passing, helping them navigate their grief. So here you just see that the licensed nurse plays in addressing the emotional need of the patient and their family in diverse healthcare setting. In the patient case also, like the women who are a person with the chronic condition also, and the person who are in the end stage. Like in the different setting, licensed nurse having their different role. And but they are taking care of the emotional health. By recognizing and addressing the emotional and the mental aspect of care, these nurses contribute significant to the overall well-being and recovery of patient and their families. Competency of the licensed nurse. Providing competency in providing licensed mental health nursing assessment and the consultation, assessment of risk including self-harm, providing nursing assessment and advice of the patient capacity, identifying and consider the ethical issue, providing nursing advice on the legal issues, intervention used in the licensed mental health nursing, admission, discharge of patient, maintaining accurate record documentation and the report writing, providing nursing advice on the management and care of the patient with complex psychosocial and the challenging presentation. Then competence in providing nursing advice on the medication, working with the people with specific physical illness, the person, those who are older, mother, babies, children, young people, according to the emotional level, she should have a competency. Then working people with a substance misuse problem, working with people with specific psychosomatic disorder and the learning disability, education, training, and the supervision, evaluating licensed mental health nursing provision. So there are the so many areas where the licensed nurse is working, and she should have a such type of the competency while working in a different scenario of the health setting. So here I am having a checklist of a competency for intervention used in the licensed mental health nursing. This is the checklist, what she has to keep in this scenario, range of therapies suitable for crisis work, physical, psychological comorbidity, and the mental health emergencies. She should provide the therapeutic intervention both in a single assessment and in ongoing short-term work. Explain the rationale for providing a particular therapeutic response to an assessment, right? Then therapeutic intervention in range of clinical situation, like for example, crisis situation, risk management, mental health emergencies, and a range of the psychosocial and the behavioral presentation in acute hospital environment. Then intervention and outcome with consideration for the clinical governance and the audit needs. So you just see that there are the number of points she has to keep in mind while taking care of the mental health nursing care. Like what are the interventions she has to use being a licensed nurse. So competency for providing the nursing advice on the patient, like here, what are the local policies for adherence, right? Then demonstrate the knowledge of the principle involved in the prescription of medicine, demonstrate a knowledge of the impact upon mental state of a broad range of medication, including psychotropic medication, polypharmacy, explain the rationale for providing the advice on the medication prescribing for the patient and the mental health problem, explain the role of the different member of the broader clinical team in the prescribing of medication, accurate and the comprehensively record in all relevant documents, communicate any advice, information to the member of the wider clinical team, assist physician with the prescription of medication by involving appropriate psychiatrists, pharmacist, communicate the rationale for and impact of the psychotropic medication to patient care and the wider clinical team. So like for every competency, they are given the checklist, what all the points she has to keep in mind while working with in a particular field. Challenge faced by the psychiatric nurse, like conflicting view with the multidisciplinary team, right? Because they are having a less time to counter with the patient. Because of that, she could not able to provide appropriate intervention on a time, right? Dealing with self-harm, suicidal tendency, behavior of the patient, dealing with emergency, maintaining confidentiality, privacy, interruption by the multidisciplinary team to meet the patient's needs. So these are the main challenge faced by the nurse, like complex patient cases. Say licensed nurse often deal with the patient who have a complex medical and the psychiatric condition. To maintain a balance, treatment of both aspects can be challenging, and misdiagnosed or inadequate care can have a serious consequences. working in the team, she has to take care of each and everything, and she has to convey each and every minute things related to the patient to the team member. Then sometimes emotional burden, like dealing with the self-harm patient, suicidal tendency, behavior of the patient. So sometimes it may lead to the emotional burden to the liaison nurse, because while providing the emotional support to the patient and their family, especially in case of the severe illness or end of life care, can be emotionally draining for the liaison nurse. So nurse must manage their own emotional well-being while helping others navigate like distressing situation. Sometimes there is a like conflict because of the resource limitations. In many healthcare settings, resources for the mental health services may be limited. Liaison nurses may struggle to access the timely psychiatric assessment, therapy services, appropriate follow-up care for their patient. Then interdisciplinary collaboration, like collaborating with various healthcare professionals, can be challenging. Ensuring effective communication, coordination between the psychiatric nurse, medical team, social worker, and other specialists is crucial, but can be complex in nature practice. Workload and burnout is also the one challenge for the liaison nurse, because nurse is this in this role may experience high workload and the stress due to the diverse demand of their job. This can lead to burnout, impacting their own mental health and the job satisfaction. Patient capacity and availability is also the one of the challenge. Psychiatric consultant like nurse may be a high demand, and there may be the limitation on their ability. Yes, in India it is very much limited. But you can see that whatever we had done today, in each and every aspect, we needed a licensed nurse in a hospital, in the every hospital setting. So this can result in delay when the emotional like licensed nurse is not in the team. Then it can lead to the delay in providing the essential mental health support to the patient when it is needed most. Sometimes ethical dilemma is also the one of the factor, or the challenge for the licensed nurse may face ethical dilemma, particularly in situation where a patient wishes or decision making capacity is compromised. Balancing autonomy and the duty to protect the patient can be challenging. So these are the challenge which may be faced by the licensed nurse. So these are the references where I took my material. So in like I just conclude my topic with this, like despite of these challenges, like psychiatric consultants and licensed nurse plays a vital role in improving the patient care and outcome by addressing the emotional and mental health needs of the patient. Their dedication, commitment to holistic care make a significant difference in the healthcare system. Like effort to provide them with adequate resources, support, and training can help mitigate these challenges and enhance their effectiveness in their critical role in the healthcare setting.
Thank you, ma'am.
Thank you, sir. I hope
Yeah,
I
yes, ma'am.
justified with my job.
Yes, ma'am. Yes, ma'am. Of course. Such a wonderful and again another detailed presentation related to the topic licensing. You know,
Yes, I think I took much time for completing my topic.
no, no worries, ma'am, because we all enriched with a lot of knowledge related to, licensed psychiatric nursing. That's really a good time we had. I hope all the participants also had the same feeling as like me. And because of the time constriction, and let us get into our next topic. That's Dr. Nagarajaiah sir. And sir has recorded a video and sent us. So we are going to listen from him. And before getting into topic, just let me introduce our speaker, Dr. Nagarajaiah sir. And sir has done his BSc Science in Mysore University in the year 1970 and did his BSc Nursing in Bangalore University 1974 and did his diploma in psychiatry nursing in NIMHANS 1978 and did his MSc in again NIMHANS in 1990 and PhD in Bangalore University under the NIMHANS in 1995. And also, sir has done LLB in 1984. So when I gone through his curriculum with a CV, it's more than 20 pages. Such a eminent person. And if I wanted to introduce him with the entire curriculum vitae, it's like a presentation. It's going on, and sir has published 151 international journals and 14 national and 133 again national level chapter. He authored 32 books as chapters, and also concept article he wrote 12, and the monographs proceedings 13, manuals 13. So it's all in his credit. And so Sarah's held in a different position, former additional professor in Department of Nursing in NIMHANS and Director of Nursing in Arudi Chandgiri Trust, Bangalore, and former visiting faculty in Research Center, Bangalore, and visiting professor in again Gautam Institute of Nursing and Research Center, Bangalore. And sir is such eminent professor. And now let us listen from him. Let me share his video, which he has sent before. He shared his thought on community-based rehabilitation. Let me share the screen. So can you able to see the screen? Is it visible?
Earlier it was visible, sir.
Yeah, Melvin, it's visible.
Visible, right?
Good morning to everybody.
Audio?
The organizer have called me and invited me to speak on rehabilitation-based rehabilitation
Okay, thank you.
on the eve of World Mental Health Day. You all aware that the theme of mental health is universal human right for October 2023. See, human right is a right for everybody, even for the normal people. So, this occasion, the World Mental Health Day, they said, it is a universal human rights. That means they have given a lot of emphasis for the mental health individual, for their rights. Okay, so I try to discuss, what is community-based rehabilitation for mentally disordered individual, particularly, and I will also add a little bit on rehabilitation of Alzheimer's disease and dementia. Okay, so today I will discuss on, I will try to mention, in the introduction, how the development related to the disability or rehabilitation have come up in India, and what are the policy support for psychiatric rehabilitation. And I will talk a little bit about what is rehabilitation. Many of us sometimes, the exact meaning of rehabilitation, we doesn't know. I will just say few words on what is rehabilitation. Then I will talk about community. Since we are dealing with community-based rehabilitation, I will also talk what is community. Then I will talk on what is community mental health center. I will also add on some concepts of community mental health. I will also say what is community-based rehabilitation and how the development took place. And I will also add few principles of community-based rehabilitation and some concept related to community-based rehabilitation I will also talk. Then some importance of community-based rehabilitation, why it is needed, these kind of things I will discuss with significance of the psychiatric rehabilitation also. Then I will say how we can able to do community-based rehabilitation, where all we can able to do, how we can able to utilize the resources in the community. Okay, then I will also add, what are the requirements for community-based rehabilitation, and as a nurses, psychiatric nurses or a social worker or psychologist or maybe a psychiatrist, okay, or maybe the occupational therapy instructor and other people or paraprofessionals and other professionals, how they can able to do community-based rehabilitation, or how they can able to initiate, community-based rehabilitation. These are all the things, I will try to speak today. A little bit about the introduction. As I said earlier, organized mental health care is a recent concept, particularly in India. There have been significant progress in a large number of areas of mental health care in the country. What are those? Psychiatric rehabilitation is one such areas, okay, among other developments. Beginning with the setup of Medico-Pastoral Association, Schizophrenia Research Foundation, and the Richmond Fellowship Society, you may be aware, there has been a significant growth of psychiatric rehabilitation in India. To mention some of the policies which are very important for psychiatric rehabilitation, whether you do it in hospital or whether you do it in community. These policy requirements are very, very important. In the last 3 decades, there have been a significant policy development. Number 1, the enactment of Mental Health Care Act 2017. Number 2, the rights of persons with disability, 2016, the act. Then the third one, the development of Indian disability evaluation and the assessment of scale. With this, we call it as ideas. We can able to assess, the level of disabilities of psychiatric patients. Okay. Then the welfare support available in a number of states, both in central and state government, to persons with psychiatric disability or positive development. The government of India and also the state governments, they have developed a lot of support, welfare support, for the disabled person, particularly for psychiatrically disabled. In addition, we should be able to know that there is international focus on looking at it in developing mental health care in low and middle income countries. So these are some of the developments which are occurred. As I said earlier, just to know what is rehabilitation, because people think, rehabilitation means something new, new kind of activity or new kind of work we have to add to the individual suffering with some kind of disability. No, it is not. On the other hand, like we all do many kinds of activity, including activities of daily living, whatever we do every day, when we get up till we sleep, those are all the things we call as activities of daily life. Because of certain illness, particularly, psychiatric disorder or dementia, okay, we forget. The individual after suffering from psychiatric disorder, there is a tendency, he go away from such kind of activity. He is almost like he has forgotten those kind of activity. He will not do it. Okay, he will sit idle. Understand? So what we have to do to initiate this activity, whatever we are doing prior to the disorder, we have to help him, talk to him. Okay, that's what rehabilitation. So rehabilitation restores person's physical and mental activities and improve the quality of his life to a level which is as nearer as possible to that which exists prior to his illness, what I meant earlier. Rehabilitation also means a program to develop, certain program you have to develop. It is a planned activity for individual psychiatric ill patient. Like for example, social support, how you can able to mix with other people, interact with other people. Okay, these kind of activity we have to develop. Then independent living capacity, very, very important. How the individual can able to do his work himself, look after himself. What we say, for example, one self-care activities, which includes taking care of body hygiene, grooming, health, including bathing, toileting, dressing, eating, and other routine activities. The individual can able to do himself with minimum support. Okay. And lastly, rehabilitation also focused on emphasizing vocational competencies. Like in addition to his doing his activities of daily life, some kind of vocation, some kind of job, work he has to take so that he can earn money. So that is very, very important for the individual for day-to-day life. So such kind of vocational competencies also you have to train him, teach him. Okay, this is what is called as rehabilitation. In addition, rehabilitation include training in work. Whatever the work the individual was doing earlier, after the treatment. You have to train the individual to take up those kind of activities which was doing earlier, demonstrate it, training him, okay, make him to learn. And similarly, domestic skill, like if when the individual is there in the house, what work he was doing, we have to teach him. If she is a female, like cooking and other kinds of activities, domestic activities, cleaning, these kind of things, we have to teach him. Very importantly, kinship role. Kinship role means like as a father or a mother, daughter, son, understand, or daughter-in-law, what kind of role they are performing earlier. Those kind of role we have to teach him to learn to do it. Okay, that is called kinship role. In addition, money management and budgeting. Like the individual has said money with him, he does some marketing. When he does some marketing, how much you have to pay and how much money he has to get back after purchasing such certain goods. Those kind of things he has to learn. And in addition to that, budgeting. He has got a money. He has to budget for 1 week or 1 month or 1 year. How much money is required for what kind of activities, what kind of goods like that. In addition, communication skills. Rehabilitation includes communication skill. The individual has to learn adequate communication skill to interact with family members, interact with neighbors, interacts in the workplace. Okay, these kind of things are very, very important. Now, to say what is community, people live together in a given geographical area, share common interests, traditions, culture, feeling of belongingness, that is, okay, work together, help each other. So this is what is called community. You all come from the community. You remember, in your own community, like these kind of things, how you share interest, how people share tradition and culture, how they feel they belongs to one area, one place, and they work together also. That is what community. In addition to that, communities with shared interest, values, thoughts, and attitudes encourage patients to live better, create a sense of belongingness, create a kind of acceptance by the community, acceptance by the family, understanding and inspiration. So this is what is called as a community in a nutshell. Coming to the community mental health center, which is important for community-based rehabilitation. A community mental health center is a public or a private non-profit legal entity through which comprehensive mental health services are provided principally to individuals living in a defined geographical area. So comprehensive mental health care means in addition to treatment and other facilities, we have to give also rehabilitation. Okay, the patient can able to live independently in his community. Some of the concept, as I said earlier, the American Psychological Association defines community mental health as activities that promote mental health that are performed in a community instead of institutional setting. So that means whatever the activities, whether treatment or rehabilitation, you have to do it in the community where patients are living, not in the hospital. Okay. To treat and rehabilitate mental patients discharged from the mental hospital within the community, increase awareness and reduce stigma related to mental health problems in the community. So coming to the community-based rehabilitation program support people with disabilities by providing health services at their doorstep. Okay, like this kind of activity in NIMHANS, Rural Community Mental Health Center has done it and it is doing it. Okay, establish a strong linkage between people with disability and healthcare system. Like the team consisting of a psychiatrist, psychiatric social worker, psychiatric nurse, and psychologist visit the villages. Okay, find out overall suffering with mental disorder and establish a kind of linkage between the individuals, okay, with disability with the healthcare system. That is community mental health centers. Community-based rehabilitation was first initiated by the World Health Organization, following which, the international conference, you all remember, Health for All by 2080, which took place in Almaty in the year 1978, which also as a declaration, community-based rehabilitation. It's a Almaty declaration. 4 principles of community-based rehabilitation I would like to mention: providing all the rehabilitation services needed to the individual suffering with psychiatric disorder, reducing or eliminating environmental barriers like people not talking to him, rejecting him, these kind of things in the community, compensating disabled people for any loss in their standards of living caused by disability. Okay, so here disability means here not exactly physical disability, it is a psychiatric disability. You all know that the individual suffering from psychiatric disorder, after suffering, he will lose his motivation, loss of interest, loss of motivation. Okay, these kind of things, we call it as a disability. promoting social integration and self-actualization. So for such kind of individual, we have to do, promote social integration, and he can able to live independently as much as possible in terms of social actualization, protecting and ensuring the security of disabled people in the community, not harming the individual. Some of the futures of community-based rehabilitation are community-based rehabilitation gets neighbor, parents, friends, employers, teachers involved in a great attempt to drive general development. The entire community, people living, they all has to involve themselves, for the development, overall development of the patient suffering from psychiatric disorder. Basically, education, health services, employment, vocational training, all are connected with the community-based rehabilitation. Some of the components of CBR are health and health promotion, education, livelihood, like activities of daily life, skill development, social and personal assistance, empowerment, and refer some of the patients which require additional rehabilitation services to the tertiary care hospitals in the cities or at district level or state level. Okay. So to say, what is skill development? Like individual, they require certain skill. They have skill, like domestic skill, cooking, cleaning, okay, looking after the children, various skills. Like a person who is working in an occupation, maybe a clerk, how to draft, how to write, how to present it, these kind of things. So these are all skills. Like a person, a carpenter, he knows how to do a chair, how to do a table. It requires certain skill. So such kind of skills, maybe a social skills, maybe a vocational skills, we have to help the individual to learn it. Some of the importance of community-based rehabilitations are social interaction plays a key role in improving mental health. Everybody knows, it is recognized that interaction is very, very important, or communication is very, very important. It plays a major role in improving the health and mental health of the individual. Some of the studies have showed that exercises and recreation improve mental well-being by improving self-esteem and cognition. It is important for caregivers, our friends and loved ones to understand the impact that rehabilitation has on daily life. Every day they have to learn, whatever they are doing and practicing. If patient is sitting idle, not doing anything, not talking with anybody, so then he becomes almost like an idle person. Okay, like a rusted iron. So we should not leave him. So that is why rehabilitation is very, very important in every day. When members of the general population have direct interaction with people with mental illness, they might experience people with mental illness as no different from other people. When they start talking with them, mixing with them, ultimately the psychiatric patients also start doing the same kind of interaction and other kind of activity along with other people. Then people feel, they are no way different from other normal people. Studies found that contact with people with mental illness decreases the desired amount of social distance from people with mental illness. These are all some of the studies which I have noted. There are certain significance in the area of psychiatric rehabilitation. What are these? Development of psychiatric rehabilitation technology or intervention. That means how to do rehabilitation. What kind of technology is required for rehabilitation, rehabilitating the individual, like that. Community care facilities for rehabilitation and the service delivered. What kind of facilities are there in the community we can able to make use of for the psychiatric rehabilitation. Caregivers in community care facilities. So caregivers are very important. For example, family members are the caregivers in Indian setup. Okay, sometimes the NGOs, they play a role in providing care to the people with a psychiatric disorder and other disorder. Suppose if the families are not there. So caregivers of psychiatric patients at home level, because many rehabilitation work we need not search and go for a new rehabilitation in our house, in our houses. There is a lot of activity to do. So you can involve the patient to do such kind of activity other than if he is going for a work outside, then we have to discuss and train. Then research in psychiatric rehabilitation is also one of the significant area. People can do the research, how they can able to rehabilitate and how rehabilitation pays to improve the mental health of the individual. Then policy support for psychiatric rehabilitation, whatever the policy development, as I said, mentioned earlier, which the government of India has developed, we can make use of those policy for rehabilitation of psychiatric individual. Suppose now coming to the community-based rehabilitation activity, how can able to initiate? One is off your home, another is quarterly home, centered workshop, day hospital, night hospital, pastoral hospitalization, daycare center. For example, off your home, where patients are left in a rented house in a community, okay, within the compound of the hospital or very near, and leaves the selected patients there, the discharge, about to discharge the patients there. They can able to do their activities themselves. They can cook themselves, wash themselves, take bath themselves, buy things required for cooking and other kind of activity. So that means they are doing themselves. So that is fair. Similarly, quartered homes, which are nearer to the hospital, the patients themselves, stay in a rented house, do everything with minimal support or no support from the hospital staff. Sheltered workshop. There are so many sheltered workshops are there in the community, like maybe mechanic, scooter mechanic, car mechanic, okay, or printing press, okay, or some other services by the NGO. Like, for example, in Friends of NIMHANS, one of the females, actively involved in NIMHANS rehabilitation, we call them as the Friends of NIMHANS. All discharged patients who require rehabilitation, we send them to them. They train them, okay, in making pickles, okay, and other kinds of materials which is required for cooking, okay. And nowadays, it is very important, these materials prepared by psychiatric patients, okay, with the help of the Friends of Demands, they send it to abroad. It is famous in abroad. So whatever the money they get, they distribute to the patient. Understand? So such kind of sheltered workshops in the community, we have to identify. We can make the patient utilize those kind of opportunity with the help of the professionals so that they can be rehabilitated. Okay, like day hospital. So here patient comes for the hospital for the treatment during day. Night, now you will go back to the family and see. Okay, so night hospital, where patients are not able to adjust with the family member. Daytime they go to the workplace, they work, and night they come back to the hospital. Then partial hospitalization, like for example, Saturday and Sunday. Okay, they come to the hospital, they stay there, they take treatment, they involve in rehabilitation, they go back. And daycare centers. Now I will discuss in the next slide, the daycare center concepts. And importantly, these are all the things you have to do. One thing, if you want to do basic community-based rehabilitation, you have to do the assessment of the community resources, what all different things which are available in the community, maybe a health or social sector or a farmhouse or welfare, social welfare department or a village panchayat or a taluk panchayat officials, okay, or maybe a traditional healer or priest, like that, you have to identify where you can able to do the rehabilitation of the psychiatric patients. Identify natural support system and professional support system. What are they? See, natural support system provides material aid, what required for the rehabilitation, knowledge on their leaders, financial resources, where we can able to get finances, manpower resources, okay, role for performance of the individual. And the professional support system provides information on healthcare and caregiving professionals like teachers, social workers, and other paraprofessionals. We can able to get their help for the rehabilitation of the patient in the community. Another important thing for the community-based rehabilitation is liaison and networking with community resources. Like you identify the various resources, you develop a liaison and activate, with the liaison activity, patients can able to rehabilitate. Prepare resource map of locality for rehabilitation, like very special schools are there. For example, mentally retarded special schools are there. Training centers are there where psychiatric patients discharged from the hospital, they train for rehabilitation in different centers. You have to identify. Then influencing people like key leaders, they can able to help for rehabilitation, like village leaders. Okay. Then temple priest, panchayat officials, district health officer, taluk health officer, disability welfare, officer, school teacher, anganwadi workers, centers. Okay. So, for example, I'll give one example here how we can able to utilize these kind of very resources which are available in the community. In rural community mental health center Sakalwara, where I was working earlier, during our village visit, we have found one male patient with 45 years suffering from schizophrenia. He was just no parents, no other relatives or friends. Okay, he's all alone. Every day he used to wander away, and night he has to take shelter in the nearby temple. Okay, the priest knows it. So what we did, we have identified him, we have given the treatment, we have taken the help of the priest, so that we have talked to the priest. The priest has given a job of cleaning the temperature premises. After a few months, once the priest has realized, the patient can able to work, we have recommended the priest to give, help him, like he was contract basis, he was given, a job of distributing tokens, collect the money, distribute tokens for various kinds of puja. Gradually, after 1 year, we have approached the taluk office or a panchayat office. We have approached, we have discussed with him. They have taken him on contract basis as an attender. and they used to pay some money for it. Since he does not have a house, we have requested the Panchayat officer and the Taluk, Tahsildar to provide a house for him. So they have built a house. He started staying and going and work there. Like that, utilize the services or resources in the community, depending upon the needs of the psychiatric patients, we can able to help him to rehabilitate. And similarly, there are community volunteers are there, local employees are there. We can able to use them for rehabilitation. In addition to, we have Lions Club, Rotary Club. We can take their help. So we have used the Lions Club and Rotary Club members for our extension services. Every month we used to go at Taluk Hospital, okay, and provide psychiatric services, including the mental education, rehabilitation, and the Lions Club and Rotary Club members used to come and help us. Okay, so ultimately recognize the vital roles for rehabilitation of these kind of resources or individuals. Then how you can able to do rehabilitation in the community, utilize the service of medical services like PSC doctor, multipurpose health worker, provide them training and orientation, which we have done in NIMHANS, what we call as the NIMHANS model. We have trained all the general practitioners and health workers, okay, in basic mental care delivery. So they started doing it. Then mental health centers which are available in the community, rehabilitation programs which are available in the community, vocational services which are available in the community, social services which are available, you can make use of them for rehabilitation. Then offer services like identification. Like for example, in rural community mental center Sakalavara, we have visited 180 villages of the catchment area. We have identified all psychiatric patients in 180 villages. We have provided treatment in their doorstep in the families only. We have helped the family members to rehabilitate the patient in their homes only, like agriculture activity or domestic activity. So the patient has improved, they can able to make use of the patient for various kinds of agriculture activity or domestic activity. Understand? Individual assessment and service planning is very, very important. Like when we do individual assessment and service planning, okay, we can do case management, crisis intervention, community and supporting training, housing services, okay, employment opportunities, remedial education in schools. Understand? Like home care services, I will give an example. I myself, as a nurse therapist, provided home care services, home visiting, and giving the treatment to the psychiatric patients in urban areas. With the help of the consultant from NIMHANS, they used to provide, the drugs, and I used to go and deliver the drugs, okay, and do case management, crisis intervention, patient education, family education, and all kinds of services, okay, and rehabilitate them in the houses only. For example, in a house, a lady was there, she was doing tailoring. Because she has become sick, mentally ill, she could not able to do the job, and they have sold out the tailoring machine also. With the help of the social worker, I have contacted the social welfare department. They have provided a tailoring machine. Okay, we have taken the help of the tailor in the village, and he could able to help this individual for tailoring, and the patient can able to do tailoring gradually. She has learnt it. Similarly, there was a lady with 65 years of age suffering from schizophrenia. She had her livelihood with what is called as preparing roadside eateries like bonda, bhaji, coffee, tea, and look up and managing the family. Because she suffered from psychiatric disorder, schizophrenia, she could not able to lost her job. She could not able to do it, stopped it. So in home care services, I visited the home, and with the help of the consultant, provided the medication to her. Okay, she has improved. I can able to make her to initiate the same activity. Okay, preparing the roadside eateries. Okay, she started doing it, and she can able to manage the family. Okay, like that, these kind of things we have to do it in the community. We did not search for any new things. Then home-based rehabilitation, a plan. What is that home-based rehabilitation? A plan of activities can be made to keep the patient productively engaged at home. As I said, if she's a housewife, she can make her to help her to do the cooking activity, cleaning activity, okay, taking care of children, like engage her productively. Then the day structured activities must be planned based on patient interest and capacity. How much the patient can able to do, whether the patient is interested. Based on that, you have to have a structured activity. For example, home care by nurse therapist, as I said earlier, wherever I visited, I helped them in make cooking, tailoring, housekeeping, these kind of activities. Okay, so this is what we have to do it. Then establish coordination and linkage services. This is very, very important. I have already explained to you, like education sector, find out all the schools and colleges. Okay, like I will tell you another example in urban community mental health centers, where we had in Bangalore. Like for example, one patient was there with graduation. He was a BE graduate. He was doing tuition because of the disorders, psychiatric disorders, schizophrenia. He stopped doing the tuition, and he started coming to our mental health clinic. And we have found, some of other patients who have failed in SSLC, failed in high school, failed in middle school. So with the help of this engineer, okay, he was doing tuition. We make them, a structured program in the daycare centers in the urban community mental health. He can able to take classes for the individual, failed with PUC and failed with SSLC. Ultimately, they can able to pass PUC and SSLC. They can continue with their education. So this is what, education sector, you can able to make use. Social welfare agencies, as I already said, there is a lot of activities, or also they give a lot of funding and other materials. You can make use of them. Then voluntary organizations like NGOs, Lions Club and Rotary Club members, they do a lot of rehabilitation activity for general healthcare activity. As I said earlier in our extension clinic, with the help of teaching, we made them to involve in psychiatric rehabilitation also. Self-help groups like Friends of NIMHANS, urban mental health clinics in KGP Hospital already have discussed. Now we have involved them. Like we have collected the patient who are coming for treatment. The family members used to bring and leave them, from morning till evening. And we have taken the help of the Friends of NIMHANS. They used to bring, the old magazines, teach them, the paper cover making. Okay. And ultimately, in their own locality, when the patient goes back, they have to count the covers 50 or 100 or 25. They have to sell it in the locality. So they have found provisional stores, okay, and bakeries. They used to start, selling them and collect the money and bring them back. So once in a month, now we used to distribute those money to them. Like that, you have to take the help of the self-help groups. Then professional organization, general practitioner training program, we did it, and ultimately they can able to do the psychiatric treatment and rehabilitation. Then employment agencies we have found in the community, as I said, sheltered workshop, various kinds of things we have approached them. They can able to provide some job to the patients with the psychiatric problem. Okay. Then organize and develop liaison services, as I said, with the day hospital services, daycare center, night hospital, sheltered workshop, off your home, community residence, evening hospital, weekend hospital, like that. Okay, like daycare center concept, I will explain in future. Okay, in the next coming. Like general hospital psychiatric units here, treatment and medications, they can able to do, and they can also do rehabilitation. Training of volunteers and key leaders, the psychiatrists in the general hospital psychiatric unit can able to do, and the psychiatric nurses can able to do this kind of active orientation of the volunteers and key leaders. For daycare centers, for rehabilitation and for occupational therapy, vocational instruction help can be given through general hospital psychiatric unit. For example, in community, Vellore, the Christian Medical College Vellore, there, they have a family, treatment units. They admit the psychiatric patients along with the family, and the family has to teach them every day the routine activities like cooking or other kinds of activity. That is very important. Similarly, in NIMHANS we had, separate kitchen, separate room for the psychiatric patients. We used to admit patient along with the family member. The family member, we used to encourage them to involve the patient in the routine activities of domestic activities. Like that, utilize village rehabilitation workers and multipurpose health workers in the community. Coming to the daycare centers, like NIMHANS and similarly the government medical college hospital, Chandigarh, they had a daycare center. Okay, so these are all individualized rehabilitation. Rehabilitations are planned and administered by psychiatric nurses and occupational therapy instructors and psychologists and social workers. What are they? The patients follow daily routine activities. They are trained in daily living skills and skills like training, carpentry, printing press, bakery, soap making, etc. For example, in men's daycare center, we had almost 25 different types of varieties of activities. Okay, so depending upon the interest of the patient, when patients are there, we used to do the assessment and put them, tailoring area, okay, or candle making area or patient making area. The instructors are there in each, department of these kind of vocational training rooms, and they used to teach the patient. Okay, and whatever the material they prepare, we had a showroom there only. We used to sell them to the public who come for the hospital, and whatever the earnings, once in a month, we used to distribute the patient. In fact, we have opened a bank account for each and every patient. The amount whatever they earn, it has to be credited to their bank account. Okay, we have teach them, how to draw the money from the bank. So this is how we can able to do rehabilitation. They are also involved in recreational and outdoor activities. Okay, and product prepared by the patient, as I said, sold out, and money is distributed every month, through bank in their account. Patient used to come at 9 a.m. and they used to go back at 5 p.m. And similarly, some of the outdoor activities, what we call as the community outreach programs, which are very useful for the community-based rehabilitation. So we had, NIMHANS extension clinic. Okay, every month we used to go to taluk level, 5 different taluks, every month we used to go a batch of psychiatrists, a team. Okay, and involve, the doctors and health workers and nurses of the taluk hospital, and in addition to Lions Club members, Rotary members, and other volunteers. Okay, teach them, the different concept of case management, daycare program, crisis intervention, emergency psychiatric services, mobile crisis team, group and individual psychotherapy program using clubhouse model, supported employment activity, support them, as I said earlier, with the centered workshop in the community, some kind of supported job to the patient, which have been done by other personals. Okay, the psychiatric nurses and the psychiatrists, they can initiate these kind of various activity in their hospital clinic. Okay, so like these are some of the community outreach program, wellness and recovery action plan. Okay, we had also in NIMHANS, well-being centers. Then consumers run programs, voluntary organization, what we call advanced directives or legal documents allow the consumers to direct how future relapses and treatment needs to be planned. With the help of these kind of advanced directives, the caregivers can able to learn, okay, what are the future relapses, how they can able to identify early signs and symptoms, okay, and get them for the treatment in their nearby centers. Then another concept is trans-institutionalization. Whenever patient is required for a higher treatment or for different kinds of rehabilitation which are not specific to particular patient in the particular locality, you just send them to the district hospital or state hospital. So there they can able to learn these kind of programs. Then involuntary treatment, like many patients, they don't have houses. As I gave one example of our Road Community Mental Center, they don't have families. They are suffering from psychiatric disorder. They wander. Okay, so there should be some kind of activity where you can able to identify them, treat them, as them on rehabilitation. As I said, the example in Road Community Mental Center. These kind of activities have been done by other personnel in different countries. Little bit about Alzheimer's rehabilitation and dementia rehabilitation. The rehabilitation program for persons with Alzheimer's differ depending upon the symptom, expression, and progression of the disease. With Alzheimer's rehabilitation, it is important to remember that although any skills lost will not be regained, particularly for dementia and Alzheimer's disorder, it is not possible to reverse them. It is irreversible, whatever they lost. The caregiving team must keep in mind the following. In managing the disease, physical exercise and social activities are important, like proper nutrition and health. Physical exercise and social activity for the Alzheimer's disorder or dementia is very, very important. Plan daily activities that help to provide structure, meaning, and satisfaction for the individual patients. Okay, it should have a structured activity at their level. It should have a meaning. Understand? Like for example, you make the individual to concentrate, be attentive. Okay, you give a painting job. Let him paint. Okay, maybe I can make painting of an animal, painting of a vegetable, whatever it may be. So that's got a structure and it has got a meaning for the patient, and he will also get satisfied. So these kind of activities are very important to regain the activity and also to regain the memory. As functions are lost, most of the functions of these dementia or Alzheimer's disease are lost. Adopt activities and routines to allow the individual to participate as much as possible in activities of daily living in their respective houses. Whenever you do certain activity, involve the patient, demonstrate, make him to do also. That's what. Alzheimer's rehabilitation, keep activities familiar and satisfying to the patient. Allow the individual to complete as many things by himself or herself as possible, like washing of vegetables. You just show it once. Let patient, let him himself wash it, clean it. Okay, and cut it if possible. Like that, each and every activity you initiate and allow the patient to do it. The caregivers may need to initiate an activity, but allow the individual to complete it as much as possible by the patient. Then provide certain cues for desired behavior. For example, label up drawers, cabinets according to their content, and okay. And similarly, the bathrooms, bedrooms, etc. has to be labeled Okay, either in the local, whatever the language, they know it. And in addition to that, they should have a figure like male toilet for male, male photo, female photo, okay, or bedroom, whatever may be. For illiterate patients, those patients who doesn't know reading. Similarly, playing music, having objects to touch and interact with, and hand massage can all help people with dementia and Alzheimer's disease in the later stages. So some kind of music depending upon the whatever the patient was doing earlier or whatever the family was doing earlier, maybe a bhajan or maybe some other music, having object to touch like a dog, let him touch, or vegetable, let him touch and feel it what it is, understand like that, and interact with, okay, and know that what is that he has touched, what it means to him, like that. And hand massage, these kind of things are very, very important. Similarly, keep the individuals out of harm. These patients with dementia and Alzheimer's, they doesn't know whether fire is harmful to them because the memory is lost. So, or if there are a lot of furnitures, they harm themselves. So that's what, remove all safety risks. For example, car key, he may take the car key and start it, okay, he may run it and he will end up with a accident. Similarly, matches, you may fire it, and additional furniture, everything you have to remove it where the patient is living in his room. As a caregiver, full time or part time, it is important to understand your own physical and emotional limitation, because as a caregiver, it is a lot of burden for the caregivers to treat a psychiatric patients or individuals suffering from dementia or Alzheimer's disease. So he needs counseling, he needs a certain kind of recreational activity, he needs somebody to really help him, talk to him, explain him, like that. This is very, very important. So with this, in addition to that, Alzheimer's disease, some activities which we call, good, that depends upon you. Like take him for a walk with your help. Help him to plant flowers. Okay, help him, watering the plants. Help him, let him feed the birds. Rack leaves, remove it. Go to park, sit on the bench or swing. What activities in the park you can do it with your help. Watch dogs at a dog park or surrounding area. Let him interact, what he has seen it. So these kind of things are very, very important for rehabilitation of the dementia or Alzheimer's patient. Similarly, lot of studies have mentioned, physical exercise and lifestyle activities are very, very important. A minimum of 150 minutes of moderate exercise is recommended every week for health benefits. However, 30 minutes of physical activity 3 times a week may improve cognition in people with dementia. See, that's what they have found in the research. Regular physical activity may lessen the risk of Alzheimer's disorder and slow the onset of or progression. So this is very, very important. Okay, I hope you understood this concept. So another important thing, maybe you can do it, once you recognize, the individual is suffering from dementia or Alzheimer's disorder, what we call the brain exercises, some kind of task, mental task. That's what we call as a brain exercise. What are those? Play games that involve your mind. Example, brain challenging games or mental activity can include chess, game like chess, tabletop games or video games, word and number puzzles, crosswords and memory games at their level. These kind of concept, make it simple and allow them to do it at their level. Similarly, physiotherapists can play a role in customized exercise program. As I said earlier, physical exercise, it will definitely help, to reduce slow down the complication of the dementia or Alzheimer's disease. So you have to take the help of the physiotherapist. Ultimately, the family caregiver can learn it and do it. Research has shown positive effect that exercise can prevent or delay the onset of dementia by slowing down the cognitive decline. This can lead to improved quality of life and slowing down a functional decline expected with the disease process. Okay, so this is about the community-based rehabilitation for the psychiatric patients and also for the dementia or Alzheimer's disease, something which I mean to talk to you today. I suggest sum up with activities for you so that it will be useful for you to develop knowledge and skills related to the community-based rehabilitation. What is that? Number one, compilation of innovations, that is new things in psychiatric rehabilitation in India for dissemination of good practice and networking of rehabilitation center. You have to do it, compilation of those kind of things. The second one, the evaluation of psychiatric rehabilitation center. Wherever psychiatric rehabilitation centers are there, go and find out what they are doing. Try to evaluate how much help they can able to do for psychiatric patients. Compilation of rehabilitation care in rehabilitation facilities. Similarly, experience of caregivers in rehabilitation center. Talk to them, get their experience. You can learn many new things, which the caregivers have done, with regards to rehabilitation for psychiatric their psychiatric patients. Experience of caregivers at home setting, what kind of experience, what kind of task or work they are given to their psychiatric patients, how they can able to initiate, how they can able to make them to learn and rehabilitate. That's what. And knowledge creation is also very important. Like bibliography of Indian literature on psychiatric rehabilitation, you have to do develop research agenda for the next 5 to 10 years. Like 5 to 10 years, some kind of research activity, whatever you have done, you evaluate and outcome you have to measure it. Bring out annual report of psychiatric rehabilitation. In every year, you can bring out an annual report. What are the activities you have done in that particular year, and what are the outcomes, both positive and negative outcomes. Then lastly, dialogue with policymakers. Okay, state situation of welfare support to persons with chronic, mental illness. Like policymakers, like all administrators, like AS officer, AS officer, or MLAs, MPs, and ministers. Okay, you can have a dialogue discussion. Help them to learn or your knowledge, so that they can help them, provide some kind of support, financial and other kinds of support, for rehabilitation of psychiatric patients. Concludingly, psychosocial rehabilitation for persons with serious mental illness can be carried out by NGOs, family association, or mental health professionals or caregivers. There is a growing awareness of the mental health aspect of caregiving, both in the economically rich and low and middle income countries. Some of these studies by Srinivas Murthy and Bakshi et al., they have found, particularly in economically rich and also low and middle income countries, these kind of psychosocial rehabilitation work, can be done by NGOs and other associations and caregivers. In India, caregiving is largely done by the family members, as there are limited alternative institutional facilities for those with long-standing illness like mental disorder, particularly in rural area. So these kind of things, caregiving and rehabilitation has been done by the family member. Particularly in India, most families prefer to care for the illness, care for the ill person at all stages of illness. They take the burden, they do it. Okay, definitely, whether the state hospital, government or private hospital, it is not possible to look after all the patients suffering from psychiatric disorder or neurological disorder. The family members' help and NGOs, help is very, very important. Okay, so with this, I will stop. I thank everyone for their patient listening. If you have any questions, you can note down my email address and and I can able to reply or answer to you. Okay, since I'm not available, on that particular day. So these are all some of the references you can note down and yes, read it and increase your knowledge. Thank you.
Thank you, sir, for your tireless effort in making such a wonderful presentation. I appreciate all the participants, for your patient listening, as all the sessions are going very deep with the content, and hope everybody enjoyed the session and learned a lot, and as usual, we are going to share all the recordings with you at the end of the day, and your certificates also you will receive soon. And in its most awaited time, it's a time to announce the result of a video competition, and we received 18 participation across the country, and really we had a tough time to select the best three. Actually speaking, all 18 are wonderful videos. You can see all those videos available on the internet, YouTube, and we'll share the links also at the end of the session. And really we found very difficult to pick top three, but it's a time to announce the result. I invite Dr. Santosh sir. He's a research coordinator, and he's a great support to us in organizing all the events. Sir, please take the time and announce the result. While you announce, I'll share the screen also, the result of winners.
Thank you. Am I audible, Melvin?
Yes, sir. Yes, sir. You're audible.
Hi, good evening, everybody. Sorry that it got a bit delayed, but no issues. I am very thankful to to especially Melvin and Mallikarjun Kurwa, who really did a hard work of around 2 months, not 1 or 2 days, 2 months to organize the two successive programs, which are webinars with the capacity of more than first one was around 680. Second is also looking like around 3-digit numbers, more than 200 or 300. It's a huge coordination between the 4-5 different organizations, which itself is a marvelous to just think of such a good coordination, and it went on so smoothly without much disturbances. Point number one. Point number two, it's great to see what is the so fascinating being a clinical nurse and doing so many activities parallelly, having the 3 different shifts. It itself is a great challenge, which Mallikarjun has successfully coordinated. I congratulate him once again. And third, it's a second time we are doing this video competition, and Mallikarjun took always the first leading step in that, and I'm thankful for him. To just tell you a backdrop of it, there are 120 people who participated or who have enacted or contributed to the so-called 18 videos which we have got across the country, and he himself went to select the books which are related to the topic which he has selected as of now for this two webinars, and he is going to send them personally. So that itself is the kind of let me say, जो हिंदी में बोलते हैं जुनून जो है इनमें, जो काम करने की उनकी जो his attitude towards his only fashion towards the mental health and the doing such
Yeah. I think some network issue with them. Let me check. He's in the line only, but yeah, sir.
yeah, sorry, there was some issue related to my network. Could you hear me now?
Yeah, yes, sir.
Sorry, without making any delays and taking you a lot of time, let me go back to directly the announcement of prize, which I feel me humiliated to announce, but it's a job of mine which has been requested by Mallikarjun and Melvin. I'll go ahead with that. Thanks for all the participants, 120 plus participants who really put their hard efforts, but it's always painful to say 1, 2, 3 prizes, which has its own criteria, which is evaluated by 4 different experts, and here with I'll come to the last the important session. The third prize goes to it's called a healthy lifestyle for mental health. Students of Rajiv Gandhi College of Nursing, they won the third prize. I congratulate team of Simran Sharma, who really put hard efforts. And second prize, surprisingly, it goes to the middle part of the India. It is Pune Lifestyle of Mental Health by students of College of Nursing, BJGMC Pune. And the first prize, as usual, is a bit kind of it was a difficult competition, difficult, but anyhow, it was first prize goes to role of nurse in patient safety by students of Symbiosis College of Nursing, Pune, Maharashtra again. So I congratulate all the participants who participated in the video competition, and also congratulate the winners who won the prizes. And furthermore, details will be shared with
Please take over. I congratulate all the winners, and also congratulate all the participants. Really, all the videos and the efforts what you have put was really wonderful and appreciable. And later on, we'll circulate all the results and points on the videos of all the participants. Sir, thank you, sir, Santosh sir, for your presence and great words towards us and also announcing the result. And we are at the end of the session. Now I invite Mr. Mallikarjuna sir, to propose the vote of thanks.
Good evening, everyone. Thank you so much for attending the webinar. And first of all, I would like to congratulate all the winners of video presentation, video competition. We have got 80 speakers from different states, and everyone have done a wonderful job. Now, I do not want to waste the effort of each and everyone. So we have 127 participants in the 18 videos. So we have decided that we will share at least one book for each friend, each participant in the competition. So we have got 127 books of self-help and management, which are really valuable for everyone. And all the participants who have participated in the video competition will receive the book by 10 or 15 days. And I will be coordinating with everyone. And next thing is, I would like to give thank you for NSS coordinator, NSS President Binu Joker. And next thing is Dr. Nagarajaiah sir from NIMHANS, and Gagan Sharma, and Ishu ma'am, Simran ma'am from the Chitkara University, and Kranti Putte from Minor Sex Clinic Nagpur, and the most supporting person, Santosh sir, who has always supported and behind us to do such activities. And Melvin sir, not to mention, he is always ready to help with us in organizing the event and helping in the logistic work of the event. And with this, I hand over to Melvin sir. Thank you.
Also, I'll take opportunity to thank Priyadarshini madam, who put effort in exploring the first.
I also would like to thank Priyadarshini ma'am, who has one of the participants in video competition, and she volunteered for the presentation today also, who has presented on human rights aspects. And so with this, and one more is Ms.Bijialuxmi ma'am from Chitkara University. She also joined very late, and she has presented very well in the webinar. Thank you so much. Now over to Melvin sir.
Thank you, sir. Thank you for your word of thanks. And I take this opportunity to thank all the participants who patiently participated, attended, and this important webinar. I hope everybody had a good learning. I thank you once again for all the coordinators, organizers, participants, and happy learning. Thank you all. We'll meet you all in another great session. Thank you once again.